Welcome to the Module 4 Study Guide for Exam 1. This is the information you need to know on colds. First of all, you need to be able to identify which ones are cough suppressants, decongestants, and expectorants. Then you need to know more specifically when to avoid dextromethorphan or any of those products that have DM next to it, and when to use Tessalon pearls, codeine, and hydrocodone, and basically more what the evidence is on whether or not to use them. Decongestants, you need to know the contraindications, especially for those that with uncontrolled hypertension. And then expectorants, what their indication is and what their, I guess that's all I can say, what their indication is. Okay, for influenza, who to treat with antivirals? Those that are at risk. Who are the people that are at risk? Who are not the people that are at risk? You need to know about prevention of influenza and then the treatment. You need to know when to treat A and B viruses, when to start the treatment, how long for both prevention and treatment. And then drugs to treat, when and how to take, with food and what time of day. Inhalers. These are mostly generic questions on inhalers, on the benefits of inhalation therapy. And then what do you do about sensitization? What is the problem with sensitization and what occurs in its pathophysiology? Okay, COPD. What can I say about these groups? You need to know these groupings and the treatment that goes along with each grouping. In the test, you'll be given scenarios and you need to pick the treatment. You need to look at the inhalers closely. Know the suffixes of the drugs so you can differentiate between beta blockers, long-acting beta blockers, I should say, anticholinergics or antimuscarinics, and inhaled corticosteroids. So that'll help you determine the drug combinations. Then know these indications, kind of contraindications. So you need to know these specifically so that when you get the scenarios that you can pick the appropriate drug and eliminate some of the others. Okay, for asthma, you need to know these different steps, and you also need to know that if you have the patient on a formoterol inhaled corticosteroid, that has to be used for both treatment and rescue. So you can't use different LABAs, okay? So that's one of the things that's a little bit different. But you need to know each of these and each of the drugs for those steps.